All right. Welcome to the Davis Bozeman Law Firm COVID-19 self-empowerment, self-improvement conversation that I'm having with two of my good brothers, Dr. Brother Chris Bass and Dr. Brother Gerry White. These are my brothers from Let Us Make Man, from Black Man Lab, just from all things focused on building and strengthening Black families, Black people, and the Black community. And so, how you brothers doing?
Doing good, brother. Doing good.
Doing good, man. I love the work. We keep pushing on. It's what we do in season and out of season, bro.
Absolutely. Well, thank you all for being willing to share with all of our community members that follow us at the Davis Bozeman Law Firm. And, you know, this is a series, and we just want to continue the conversation around how can we empower ourselves during COVID-19 pandemic. And so it made perfect sense that we talked about mental health and helping restore and build the Black family with you two brothers who do this on a daily basis,
Yes,
not only for Let Us Make Man, but on your college campuses, in community, in all of these spaces and places where Black folk find themselves. So we're real excited to have you guys. And I want to start out, always really want you to lay the foundation, starting with you, Brother Bass. If you could tell a little bit about yourself in terms of your background, what your focus is, what your focus of study has been, so that people get a chance to know and see you for the scholar activist that we know you as in Let Us Make Man. So, Brother Bass, would you let the folks know who you are?
First of all, like I said, brother, I'm happy to be here. I am Brother Christopher Bass, a psychologist, formerly the psychologist for the city of Atlanta, now as a professor of psychology at Clark Atlanta University. My study as well as practice is focused on trauma, and also sexuality. So things related to sexual trauma has been the thing of my focus and what I've worked on significantly over the last 10 years.
Thank you, brother. And Dr. Gerry White,
Good.
what's up, Doc?
Hey, man, I'm doing good. Okay, Dr. Gerry White. I am a licensed social worker, a family therapist, and a counselor. I've been conducting groups with families as well as individuals for more than 23 years, focusing specifically on a few areas, dealing with family violence, dealing with premarital counseling, dealing with high conflict families, but most importantly, focusing on strengthening and building the Black family. I too am a professor of assistant professor at Clark Atlanta University in the Whitney M. Young Jr. School of Social Work, where my work has continued there in the areas of teaching all family practice and clinical family practice related courses. So I'm glad to be here and ready to work.
Thank you, brother. Thank you. And I see you brothers. I got it. You know, I could not let this pass because Davis Bozeman family has to know that I see you brothers in your blazers, and I myself am a man, but you two good brothers are men of Alpha Phi Alpha, and so we give respect to you all. I did not ask y'all to wear these damn jackets though, but we just go keep it moving.
You know they say great men think alike. Great men think alike. It's coincidental.
So, on a serious note, Dr. Bass, I just want to ask you, you know, with the pandemic, with people having to shelter in place, losing jobs, increase in domestic violence, all of the things that we know are troubling, just people who are really finding themselves in a very traumatic situation, unprecedented circumstances. What are some of the things that we as a community should look for with family members, whether they're our children, our parents, our spouses, or just community members, to make sure that the mental health condition and where people are as it relates to their mental health, they're in a good space, and how we can support them through that. So, Dr. Bass, can you talk a little bit about that?
Sure. The first thing that I would say is the most important thing ever is that 5-second pause. And the 5-second pause stops you from reacting to things that you would normally react to in the ways that you normally would react to them. So what I'm saying, or what I'm hoping people will hear, is that we have learned how to deal with stress a certain kind of way. And sometimes those ways are positive, and other times those ways are negative. So the first thing that I'd want folks to do is watch how you typically dealt with stress. Is it going to help you out in this situation? Is it something that's going to really hinder you and your growth and your family's growth? The second thing that I would hope that you all would do is just to tune in a little bit more of your focus. Whatever you're focusing in on, that's highly important during this particular epidemic or pandemic, because what you bring in is what you will process. So if you're bringing in negative information, if you're bringing in negative food, if you're bringing in negative media, you have to understand that your brain is going to process that as trauma. And then you're going to act in that vein. So watch what you pull in. Watch for irritability. Irritability is huge, because right now we can't control something. When something's outside of our reach in terms of power, then we act in ways that are unlike how we normally are. So look for irritability. Watch for boredom. And most people say, boredom? Why am I looking out for boredom? Boredom just suggests that you are not utilizing your creative mind. We are more than just one-dimensional beings. We have multiple dimensions, which means that if one thing is done, then you can always create something more, something different. So watch out for boredom. Boredom is also, or inability or apathy is also a sign of depression. So watch those levels. Watch your eating. I have to say this, we have a history of eating the wrong things as a people. Make sure that you are watching all of this food that comes into your house, because you can be doing some harmful things in the long run to not only yourself, but your children. So watch that. Also self-medication, since I'm on that. You have to watch how you and your family members are self-medicating to create calm and peace during this whole state. If you're finding that your self-medication involves things like alcohol or sweets or oversleeping, undersleeping, all of the extremes, you need to make sure that you're watching that and keeping tabs of that, okay? If you have not done this yet, create a survival or a blessings journal, okay? Where you can go backwards and look at how you dealt with week 1, week 2, week 3, week 4, week 5. So those would be my first 4 to 5 things that I would say. Hopefully I'll get a chance to come back a little bit later and give you some more.
Thank you, Brother Bass. We appreciate you, man. Those are very insightful. This journaling is something that I recently started and really started focusing on being grateful each morning, particularly under these circumstances, wanting to be able to just identify what I'm grateful for in the morning when I first wake up. But I really like the idea of keeping really I guess a journal on what we're experiencing and how we're processing things. That's powerful. Thank you, brother. I appreciate that. Dr. White, I want to ask, we obviously, one of the things that we promote very heavily is strengthening the family within the Davis-Bozeman Law community. We've been very intentional about making sure that everyone who is a part of our firm family, their health, where they are with their mental health, what kind of support they need. How does that look as it relates to our personal family? What is that? What should we attempt to build? Because one of the things that we have been saying as a firm is that we want to see this as an opportunity for us to be stronger, to be more fearless, more courageous in this moment, and not for it to weaken us. So how are you suggesting, as you talk to families, how they can build and strengthen their own families?
Thank you. It's interesting because there's so much talk out there about pre-existing conditions during time of COVID-19, and those who fit in this particular category are tend to be hit the most. But there's another pre-existing condition, and that's the pre-existing condition of the family. And
Right.
so we have to study and understand, pay particular attention to the condition of the family. And so we recognize that COVID-19 can impact that family and weaken the family's relational immune system. And some of the things that Dr. Bass has pointed out is what we look at. So I'm going to give you all a couple things that I'm going to suggest is going to help and strengthen the family relational immune system. And so here they are. Number one, I want you all to create a weekly check-in. And what I mean by weekly check-in, I mean establish a time in the family that you all are going to meet weekly to check in. Now, the interesting thing about that is oftentimes people like to get together and talk when there's an issue or when there's a problem. And so these are issue-based conversations that we tend to have. But during the time of COVID-19, to strengthen the immune system, I'm saying establish a weekly time. Hey, y'all, everybody good? How y'all doing? A check-in. So that's number one. Number two, I'm going to say establish a routine and create a process to monitor it. Here's what we recognize. There are strangers in the home now. And that means that given the routine and the life that you all have lived up to this point, everybody left out the house at a certain time. Everybody came back home at a different time. Everyone ate at different times. And so now you all are seeing each other far more frequently. So what we have to recognize is, number one, continue to get up like you do, but establish the routine, right? If you got kids in school, guess what? We know there's a period of time that they're online, right? That means somebody got to be quiet. You got to move to different rooms. So the weekly conversations is going to make it possible for you all to get clear on those routines. So number one, create that weekly check-in. Number two, establish a routine, create a process and monitor it. And then number three, I'm going to tell you all to keep yourself busy. Do some things. For example, change the room around. Make it lively. We call it the feng shui, right? It's an opportunity to do it. Plant a garden, right? Go outside. You can all do these activities. Organize the family photos. Y'all been looking at those photos for the longest. I'm talking about the ones before the digital era, right? Put them together, scan them in, right? And then number four, I'm going to tell you, do some family activities, right? Plant something, try a recipe, try to cook something, go for a walk, go bike riding. These things are essential. But what I'm going to lean on most importantly is connect with the family. We're doing this Zoom session. So guess what I'm going to tell you? Have some Zoom family meetings with the extended family, right? Have the kids interview the elders, right? So here's an opportunity that someone can get the family on. You all can record it. Plan a family reunion. You'll be amazed at how few people out there have actually benefited from a family reunion. So I'm going to emphasize these 5 pieces that I think are very important. Here's what we know that Dr. Bass has raised. With intention in the house, anger increases, emotions decrease. So these 5 things I think are absolutely critical to strengthening the family. So again, create that weekly check-in. Number 2, establish a routine, create a pattern or process. Number 3, do a family activity. Number 4, connect with the family. And number 5, do those family activities together. And so I think, keep yourself busy, I'm sorry. So with those 5 pieces, I think that we can strengthen the family immune system so that we can better deal with COVID-19. And that's my tip for restoring and strengthening and maintaining the Black family.
Thank you, brothers. We appreciate you all, man. You brothers are, we talk about frontline workers, and you all are on the front line because you're engaging with our young people, with our families, with people who are hurting, who are dealing with the stress and the mental anxiety that comes with all that this world has been hit with. And so we appreciate you, brothers. Obviously, you know how much I love you, both of you brothers, and your impact on my own family. So thank you all.
Thank you.
I really would like for you all to give them a word of hope, a sentence or two, and then tell them how they can contact you, because we want everyone in our Davis Bozeman community, Davis Bozeman Law community, to be able to reach out and touch you all, to even engage you if need be with their own families or churches or mosques or community centers, wherever they need to hear your voice. My prayer is that they will invite you in the way we have. So, Brother Bass, a word and then a contact.
My word is, when we talk about stress, stress is a reaction to something. It is not necessarily created to be something bad. It's something that is geared to protect us. So sit in your stress, listen to your stress, and find out what it's trying to teach you.
Yeah. And what I will share is these three: something to do, something to love, and something to hope for. Focus on those things that you must do. Focus on those things that you love within yourself and love within the family, and focus on something to hope for. And that is getting beyond the today and focusing on building and strengthening the family. You can reach Dr. Bass and I at in a few ways at 1-888-505-2919, or you can reach us on our website at evaluatinglife.com. Once again, we look forward to serving you all. We look forward to coming into your home and having the impact that I know that we can make. Thank you.
Thank you, brothers. And to the Davis Bozeman Law community, we thank you all. Stay safe, stay home. We are a self-determining people. No one can say when we are safe but us. So we are making those decisions on our own. And we are hopeful that you all as a family will continue to make those good decisions so that we can keep each other safe. Love you all and look forward to talking to you again next week as we continue to empower ourselves through this COVID-19 pandemic. Thank you.
Thank you.
Thank you.